Most people imagine heart attacks as a simple problem. They picture an artery slowly filling with cholesterol until it becomes completely blocked. In that mental image, the process looks like a pipe in a kitchen sink slowly clogging with debris. Over time, the opening becomes smaller and smaller until water can no longer pass through. Eventually, everything stops. Many people believe the same thing happens in the heart, but modern cardiovascular research tells a very different story. In many heart attacks, the artery that triggers the event was never completely blocked before it happened. In fact, some arteries that later cause heart attacks appear only moderately narrowed. Blood can still pass through them. The heart still receives oxygen. There may be no symptoms at all. So if the artery was not fully blocked, what actually triggered the heart attack? To understand this, we need to look deeper inside the artery wall itself. The process often begins many years before any symptoms appear. Inside your bloodstream, tiny particles carry cholesterol through the body. One of the most important of these particles is called LDL, or low-density lipoprotein. LDL particles travel through the arteries, delivering cholesterol to different tissues. Under certain conditions, some of these LDL particles slip beneath the inner lining of an artery. This lining is called the endothelium. It forms a thin protective layer between the blood and the artery wall. When LDL particles move beneath this layer, they can become trapped in the tissue of the artery wall. At first, this may not seem like a major problem, but the body sees these trapped particles as something abnormal. As a result, the immune system responds. White blood cells move toward the area and attempt to remove the cholesterol particles. These immune cells absorb the lipids inside the LDL particles. Over time, the cells fill with fat and transform into what scientists call foam cells. Under a microscope, foam cells look swollen and filled with tiny droplets of lipid. When many foam cells accumulate together, they form the earliest stage of plaque inside the artery wall. This process is known as atherosclerosis. At this early stage, something surprising happens. Even though plaque is forming inside the artery wall, blood flow may still look completely normal. The artery has a remarkable ability to adapt to these changes. Instead of immediately narrowing the passage for blood, the artery can expand outward slightly. This outward expansion allows blood to continue flowing through the center of the vessel. Scientists call this process positive remodeling. Because of positive remodeling, plaque can grow silently for years without significantly blocking blood flow. This is one reason heart disease is often called a silent process. A person may feel perfectly healthy while plaque continues developing inside the arteries. As plaque grows, the structure inside the artery wall becomes more complex. The foam cells eventually begin to break down, releasing cholesterol and cellular debris. This material forms a soft lipid core in the center of the plaque. At the same time, smooth muscle cells migrate into the area and begin producing fibrous tissue. This fibrous tissue forms a protective covering over the plaque called the fibrous cap. You can think of the fibrous cap as a barrier. It separates the contents of the plaque from the bloodstream flowing through the artery. As long as this cap remains thick and stable, the plaque may remain relatively harmless for a long time. Many people live for years with stable plaques that never cause serious problems. However, not all plaques remain stable. Some plaques develop a large lipid core with a very thin fibrous cap. These plaques also contain high levels of inflammation inside the artery wall. Immune cells release enzymes that gradually weaken the structure of the fibrous cap. As the cap becomes thinner, the plaque becomes more fragile. Doctors refer to these plaques as vulnerable plaques. Interestingly, vulnerable plaques are often not the largest plaques in the artery. They may cause only moderate narrowing of the vessel. Blood flow may still appear normal on imaging scans, but structurally, these plaques are unstable, and that instability creates the real danger. A plaque rupture can occur suddenly. When the thin, fibrous cap tears open, the inner contents of the plaque are exposed directly to the bloodstream. To the body, this exposure looks like an injury inside the artery. And whenever the body detects an injury in a blood vessel, it immediately activates the clotting system. Platelets rush to the site of the rupture. These tiny blood cells stick to the exposed plaque surface and begin forming a clot. Other clotting proteins join the process, creating a growing mass that attempts to seal the damaged area. But inside a coronary artery, this protective response can become dangerous. Unlike the plaque itself, which develop slowly over many years, the blood clot can grow very quickly. Within minutes, the clot may become large enough to block the artery completely. When that happens, blood flow to part of the heart muscle suddenly stops. Heart muscle cells depend on a constant supply of oxygen carried by the blood. When that supply is interrupted, the cells begin to suffer damage. If blood flow is not restored quickly, those cells begin to die. This is the moment a heart attack occurs. This mechanism explains something that surprises many people. Heart attacks do not always happen to people who appear obviously unhealthy. Even individuals who exercise regularly and maintain a balanced lifestyle can still have plaque inside their arteries. Plaque can develop slowly over decades, sometimes long before lifestyle changes are made. A person may improve their diet, begin exercising, and feel perfectly healthy. Yet a vulnerable plaque may still exist inside an artery wall. If that plaque ruptures, the same clotting process can occur. Another important insight from modern cardiology is that the most dangerous plaques are not necessarily the largest blockages. A large plaque with a thick, fibrous cap may remain stable for years without causing a heart attack. Meanwhile, a smaller plaque with a thin cap and active inflammation may rupture unexpectedly. This is why some heart attacks occur in arteries that previously showed only mild or moderate narrowing. The true danger lies not only in how large a plaque is, but also in how stable its structure is. Because plaque formation happens silently, many people never realize it is developing. There may be no warning signs, no pain, and no obvious symptoms. Blood flow may remain adequate until the moment when a rupture occurs. This is why heart attacks can appear sudden and unpredictable. However, understanding this hidden process has helped scientists develop better strategies for prevention. Modern treatments focus not only on reducing cholesterol levels, but also on stabilizing plaque inside the artery wall. Certain medications help lower LDL cholesterol and reduce inflammation, making plaques less likely to rupture. Lifestyle factors also play a critical role. Regular physical activity, balanced nutrition, and metabolic health all influence how plaque develops and how stable it remains over time. Researchers are also developing advanced imaging technologies that can detect plaque inside the arteries before it causes severe blockage. These tools may allow doctors to identify vulnerable plaques earlier and reduce the risk of future heart attacks. The more scientists learn about atherosclerosis, the clearer the picture becomes. Heart attacks rarely begin with a dramatic blockage that slowly closes an artery. More often, the real story starts quietly, deep inside the artery wall. Tiny cholesterol particles enter the vessel lining. Immune cells respond. Foam cells accumulate. Plaque begins to grow silently over many years. Then, one day, a vulnerable plaque may rupture. A clot forms rapidly. Blood flow stops. And within minutes, a heart attack begins. Understanding how heart attacks really start inside the artery helps reveal why prevention matters long before symptoms appear. Because the most dangerous plaque is often the one you never knew was there.